computer, but I have all sorts of technical difficulties going on right now, so I really apologize for all that.
We understand, no problem.
We can cope with anything now.
All right, well, I'm Lindsay. I'm the program coordinator at the Adult Center. I think I know most of you. Thank you for being here. And I thought it would be nice if we could meet with Cheryl. She is our COVID-19 public health coordinator right now. And so I thought she could kind of give us an update on what's going on and anything you might want to share with us, Cheryl.
So today we picked up an additional 6. So we have of active cases in the town of Longmeadow is 36.
Wow.
We are still in the yellow, but we've come down a little bit. But the reason that we have more numbers in the past couple days is just because of Thanksgiving.
Well, that's, and that'll be reported tonight, I guess, right?
Yeah.
Yeah.
Yeah. So our percent rate is gone down a little bit, but we're still in the yellow.
Okay. And then I guess, do you have suggestions for the seniors as anything they should be doing specifically?
Continue wearing the masks. I know the holidays are here. It's getting hard to talk with this, sorry. The holidays are here, and I know everybody wants to see each other, but if you're going to do that, limit it to a very, very small amount of people and keep your distance and wear your mask, because you end up having one person who shows up from your event, and then everybody's a contact, and then everybody's got to quarantine, and then, you know, if you have a household in your house and you get it from that, then you spread it. It just snowballs, and that's what most of the things are right now. It's family spread. There's only a few in the schools, but it ends up being from the families or friends or whatever. So there's only 5 in the school system right now. We have 1 from the Jewish nursing home, 1 from congregate care, and what was my other list? A couple of people who came back positive for the town happened to work at Holyoke Hospital. And Yeshiva Academy has 1 student. What I'm going to say is also JCC in Springfield for the children, the child care place. You know, a lot of them live in this town, even though they go there, and there's 2 big clusters there. So, again, it's going to go through the whole house.
So I was looking on the state website, and I didn't really find good directions for having, like, we went to great extent, but we only had 1 family member, and I feel like now we've all been, you know, put ourselves in a bad place.
You had somebody who was positive?
No, none of us are positive, but we don't have any symptoms, but how do you know that? I mean, if everybody is healthy or presenting themselves healthy, what do you do if you are just your husband and wife and a brother, for instance? How do you know, should I have not invited my brother?
Well, if you know that he's taking precautions normally, like if he's going to the stores, he's masking up, he's hand sanitizing, and you and your husband have both been diligent too, and you've kept your distance when you were in the house, like, you know, more than 6 feet
Right.
or something like that, and, you know, because that's 3 people at a table is pretty easy to separate a good amount and then throw your mask back on. I don't think you're going to have a problem, but if somebody starts with symptoms, they need to go get tested.
Right.
You can go get tested too. There's quite a few places, but some of them have a very long wait. The one at the
Yeah.
Eastfield Mall is fantastic, but it's got like a 6-hour wait, I heard.
Yeah, it just seems ridiculous for everybody to go and test if they're feeling, you know, good. If they're not having any symptoms.
Not necessarily. The reason that they started with all these pop-up places is because they're trying to get the asymptomatic people, meaning the people who aren't showing any symptoms, they look perfectly fine, but they're actually spreading the germ. So that's the reason why they put all those pop-ups up, to try to catch them and quarantine them so that they don't spread it to others by going to work or school or whatever.
So it's really not a good answer.
I know, I'm sorry. Just keep yourself healthy. I mean, the town is doing, you know, everything they can to try to remind people. We had a, on the 21st, we had a drive-through free mask event where we gave every single person in their household 2 masks.
Yep,
We have
I
put up
went
some
there.
Okay, good. Then I probably met you.
Probably.
And then it was a nice turnout too. We had a nice show of town support, and then we also had a nice show of people who came and got them. And then we have some blue signs that we put up all over town where people walk to try to remind them to put on their mask. People feel that even though they're outside and by themselves or walking with a household member, they think, oh, I don't need a mask. And technically, you kind of do, because say the person in front of you wasn't wearing a mask 10 minutes before you went through there and you didn't even know it, and they're jogging and they're huffing and puffing and say they've got the germ, it kind of floats in the air and then you walk through it. And if you're not wearing a
I see a
mask,
lot of
then
people
you would.
without masks.
I know, and it's frustrating because I drive in every day from Ludlow and I see them and I'm like, the sign's right there in front of you. They also put up 3 of those big, what do you call them, lighted up signs. There's one on Converse, there's one by the Big Y, and I'm not sure where the other one is. But there's robocalls that are going out just to remind people, hey, don't gather. You know, if somebody in your household's sick, isolate them as much as you can. Keep them locked like to their room, and like people put food outside the door on a table or something. And then if they're using the bathroom, they have to like wipe down with like Lysol or whatever you have for cleaning agents. Just those things. All those things are going to help protect you, but chances are when it gets in the household, especially if there's households with children, it just gets everybody.
That's not very good news, but.
I know, I'm sorry, but you know, there are just some people that, I have an event right now where this one household has all these kids from the neighborhood over and they don't wear masks, and now one's sick. So, you know,
Yeah.
kind of shame on them, but you know, because they don't think it's going to happen to them, and they don't think, well, I'm a kid or I'm younger, it's not going to affect me, but it does. I mean, I have an 18-year-old right now that is so super sick. He's been sick for 2 weeks, vomiting. He still has a fever 2 weeks into it. So he's in rough shape, and he's a perfectly healthy 18-year-old man.
So I guess what my comment would be, it was just my husband and I and my brother, and I did all the cooking. I touched all the food. I served everybody, and I sent brand new containers home to my sister and brother-in-law. So I thought that I did everything right, but in hindsight,
sounds like you did.
I don't think there's enough information on the state website for households. There's a lot of information for schools and, you know, places of business and all, but there's not enough information for households.
Okay.
It's just my
basically,
comment.
like the governor was trying to say, is he tries to tell everybody not to gather. You know, his big thing was, don't do it this year so that you can do it for the next many years, you know?
Yeah.
Sounds like your situation, honestly, if nobody's feeling sick, I think you've done a very good job. Everything you've explained, and I don't think there would be a problem, but if one of the 3 of you did happen to get ill feeling, then
it would
and
be
actually,
a problem.
Thanksgiving's already been gone, right? So you guys are past the time. I think you're all set, and you did all the right precautions, and that's pretty much all you can do.
Okay. I guess I was kind of surprised that there wasn't more like family and household information, direct information for people on the state website. Not Longmeadow. I met you through the vaccine time, so welcome to Longmeadow. I'm sorry you're having to do so much work.
Thank you. Yes, I'm hoping, well, this position that I'm in is actually a temporary position. It's funded by the CARES Act. It's not funded by the town. And it
Okay.
does happen to expire on the 31st if they don't extend the CARES Act. But there is another position in town that I have applied for, so I'm hoping
Oh,
that
good. I
works.
hope
So
you get it.
thank you.
Thanks for your help. I hope it helped others as well.
Cheryl,
Yeah, also Andy and I are going to be on the local TV station, and I'm sorry to interrupt you, Lindsay.
I know,
And we're going to talk about like what quarantine, isolation, close contact, all those things, what it means, because sometimes people, if you're not, in this all the time, you might not actually really understand what it means. So we are going to do a little thing on the little local TV station, but that date is to be announced.
okay, yeah, please let us know. Mr. Landon, I was going to relay your question, so maybe you could speak up.
Oh, okay. I had another one that was congratulations, Cheryl, for the important role you have.
Thank you.
I hope the CARES Act gets renewed. They're debating it actively today. So the question I had, how do you plug into the Board of Health, or who do you report to? Are you part of the emergency management group with Mr. Dearborn, or are you part of the adult center, or how's it organized?
I answer to the town manager, Lynn Simmons, but I work very closely with Chief John Dearborn and Andy Frazier, who is the COVID compliance officer. He's also on the CARES Act, and he's temporary too. But the four of us really work closely together as a team, and we bounce ideas off of each other, and then there's other departments that will call in, and we try working with them to give them ideas. So really, it's actually very refreshing that there's such a close knit and people that like listen to each other and accept ideas, and it's very nice. But I do answer to Lynn Simmons, and Andy answers to John Dearborn. But we also fall under the Board of Health when it comes to like inspections and stuff. Because when we get complaints, we go to like the stores or our restaurants or whatever, we check it out, we talk to the people, and then, so that part, we come in as the Board of Health, even though we're the COVID team.
So the select board's been talking about, a regional Board of Health with the town of East Longmeadow. And I don't know if that's been put into place or not. Do you have a relationship with East Longmeadow also?
No, I don't. And I think they retracted that. I think the last a couple meetings back in November, I think, I'm not positive because I don't know all the politics of that, but I think they retracted it because it was stalemate for so long. I know I overheard that East Longmeadow is trying to bring it back to make a team together, in contract with each other,
Yeah.
but I don't know what the selectmen plan on doing.
Yeah. But do you have a coordinating group in Western Mass to lean on or share or advise with other towns or cities or the Pioneer Valley Planning Commission? What's any bigger?
Okay, the PVPC, I'm on there. I've been on there for when I was in Ludlow too. But yes, Beverly's on that. I'm on that. We're part of that, so we can reach out. I do know all the other towns in Western Mass because I also know the public health nurses because I'm the Western Mass chapter president of the public health nurses. So I do have a relationship with all of them. And I know some of the health directors or health agents due to being at some of the PVPC meetings. So we do have them. They've given us funding. For this town, I'm not really sure what Beverly and the town manager have actually, done with other things, but we've been working, like I said, we've made signs, we're trying to, we bought masks to give out. There's just a lot of things that we're just trying to do to remind people.
I just have one last question on the organization. I saw in the paper that Beverly Hirshhorn's retiring at year end, 30 days from now. And I wondered,
Yes.
how's it going to work? Is there a replacement in mind, or if this regional thing with East Longmeadow is defunct? Because the new person replacing her, the discussion I overheard, Zoom, was that there would be a two-town Board of Health cooperating closely, you know. So anyway, what's Beverly's future look like right now?
She is retiring on the 31st. You are correct. Her position is open, and that is the one that I was crossing my fingers on. I did apply for it. I was the director of nurse. Yeah, I was the director of nurses for the town of Ludlow. I have an extensive emergency preparedness background. There are things that I still need to do in regards to her position of education, but I love to learn, so that's pretty cool.
So how about these yeah, go ahead.
What?
Sorry.
Go ahead.
I was going to switch topics. Thank you for that. The long-term care facilities, Glenmeadow and the Jewish nursing home, I've heard John Dearborn speak on it. They've had, well, particularly the Jewish nursing home, a rough time. And are things stable or optimistic in any way that in the nursing home world and the long-term care type independent living?
In the nursing home, it's pretty stable with just 2 people. One happens to be in the hospital, and I think the other one is just quarantined. I haven't heard any more because nothing else has popped up for that location. And Greenwood, there's so many green names, I get goofed up. Greenwood, the estates, they have a great plan set in place. We've met with them just to introduce ourselves, myself and Andy. And we've given them some masks too, just to help out. They've got a good plan in place. They have a place to isolate people, and I have yet to have anything over there. Since I've been taking over what's called the MAVEN. The MAVEN is the Massachusetts surveillance system for infectious diseases. And so since the 19th, I haven't had anything there.
Well, that's good, because they had over 50 deaths in the early days. I'm on the Glenmeadow board, and we had 5 cases recently. 3 were workers that on the staff, and the other, and actually had two active cases. Prior to that, we had lost 3 people. So it's a scary world out there.
It is. I have a healthy fear of it myself. You know, I'm an asthmatic. I have my parents. I won't let my mother, I get so mad, I won't let her have anybody come in her house because she's now a newly diagnosed heart patient. And I'm like, Mom, just talk from the porch. You know, I taught her how to use her phone to make pictures so we could see each other. But yeah, it's a scary thing. And I know everybody's tired and sick of it. I mean, I'm tired of wearing these things myself. But if everybody would just buck up and do it, we would hopefully get this down.
Do you think the town level will participate in the distribution, or will we be told by regional players or the state how? I noticed in England they set their priorities up on the $20 million doses they got from Pfizer yesterday, and they're going to get more from Moderna and everybody. But so what's going to happen here? And will you, the town, be involved?
Right now there's a contract with CVS, and I want to say, I don't know if it's Stop and Shop. There's a couple places that actually have contracts where they're going to do it, but we know through talking to PVPC, they are going to keep updating us. They actually mentioned it today on a meeting that I was at. There's nothing set in stone yet, but it's obviously going to go out to the healthcare workers first and like the frontline emergency people. And so they're hoping by the end of the month that some of those people will get it, but by regular lay people probably, I mean, there's risk groups that'll come first, but regular lay people probably by spring, and we will get some. The challenge is how are they going to supply it, because some of them have to be frozen like what,
Yeah.
negative 75 or something.
Yeah.
And
67.
and right now we don't have a public health nurse. There's a position open for that also, and her position is part-time for 27 and a half hours. That's why they were going to connect with East Longmeadow so that that nurse would have a full-time position. When it comes down to the vaccine, right now I guess the MRC, the medical reserve, the volunteers for the town is probably a little bit on the stalemate side. So if I perhaps get this position, I will try to re-bring that back to life. And then hopefully have clinics. I'm a nurse too, so I can give vaccines, you know, and hopefully we'd have volunteers that were nurses or whatever.
Thank you.
Sounds like somebody's out there.
Does anyone else have a question? You can feel free to use the chat box or a comment for Cheryl.
So John Dearborn, the other gentleman, you said he's going to report to him, Andy Frazier, and but you are going to report to the town manager, right? Is that is that a good way to line this thing up? Does it have some advantages to do it that way?
It's just who they're working under. Again, Andy and myself are paid through the CARES Funding Act, and we are temporary till the 31st. I came on the 21st of October. Andy was here earlier than that. But like I said, we all work very closely together. I mean, many times a day we're in conversation or meeting or whatever, bouncing ideas, asking questions. So it's just all of us are close, and what one person says, everybody's going to know because it's just we're very tight.
I see there's 2 openings on the Board of Health advertised this morning on the town website. Maybe you can get some epidemiologist type medical women or men to join the Board of Health to strengthen the connection there.
Yeah, that would be nice. I don't think I've really met the Board of Health board members. I've met the selectmen, especially when we did the mask event. I got to meet them all, which was really kind of very inspirational just to see all of them out there at that event. It was just a nice showing of support of what the town wants to do to protect its residents.
Thank you. I don't see any other questions in the chat. Does anyone else want to unmute themselves with a question or comment for Cheryl?
So you're going to have a public, Jim or Lindsay, you're going to have a public health place in the new adult center?
There is a nurse's office. Yep, and it's you know, it's nice and big enough for everything she or he needs to do. But that's as far as I know. Jim's actually working on something else. But
oh, you look like he signed on.
Yeah.
What's the situation in the schools? Are you comfortable, Cheryl, with the way they're managing things and, you know, hybrid, non-hybrid, and whatever? You feel good about the way that's being handled?
It is. I talk to Marty every day, the superintendent of schools, try to give him the numbers, try to tell them, you know, what age group, which schools it's affecting. The numbers in the schools themselves are not bad at all. There's just a couple high school students. I have a long list of names that I do here. And so there's only a couple, like one at one school, one at another school for the elementary children, one at Yeshiva, one at, I think there was one at St. Mary's too. And the schools really have, they want to stay open, so they are really, 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 really trying. So again, Marty made the decision to open up on the 7th because he wanted to try to curb the problem with Thanksgiving because he knew people were going to gather. So it was a tough decision to make, but he was part of a big group. It was myself and Andy and John Dearborn and Lynn and, oh my goodness, like about 6 other people. And, you know, he had a tough decision to make, but I think it was a really good one. And I think once they go back to their hybrid on the 7th, it should be okay. It all depends on their staffing, because the staffing all of a sudden might be an issue.
Yeah.
Yeah.
Good. Well, that's good. So I went to a MIAA event with a granddaughter at a open air track meet a week ago at Tantascwa and Quabog high schools. And they had me sign in with the gentleman stopped me coming into the field and said, you have a cell phone? I said, yes. And he took me over to a sign, and I had to sign in to the MIA site and identify myself and et cetera. For contact tracing in the future, he told me if somebody at the site, you know, we were all separated, standing in open air, but he said, if somebody comes up, we know you're here and we're gonna tell you, you've been exposed. And I said, that's pretty progressive, and you know, I'm a really willing participant. I don't have any privacy issues about that. So are we going to adopt that in all, you know, any events that we hold here in Longmeadow? Does it have to does it just have to apply to sports? Couldn't it be?
No, actually, some of the restaurants are actually adapting that, because if an employee or somebody, they know who was there that day. So it's actually bits and pieces around town. It is being adopted here at like the town buildings. If there's any visitors that come in, we have a form that they have to self-certify and sign off on. There it is, there's your form. And all the employees have to self-certify every single day and keep that paper, because if Andy comes by and it's not filled out, you know, he's gonna have a talk with you. But the reason behind that is should something happen at that event, now they have the people that were there instead of missing out people that could potentially be spreading it around even further.
Yeah, and my daughter was in school this week. She's in the inclusion preschool at Will Swamp, and we had to self-certify her each day, as you know, Cheryl, because this was that special week and the preschool was still open. And so each day I had to check her and certify her so that everyone was a little more cautious.
Hey, Cheryl, when you talk to Marty, tell him I listened to his discussion about the town or school department refusing to do rapid testing or electing not to join the group that was going to provide rapid testing for us. And his logic was, go ahead.
Go ahead. I can step in on that one, but go ahead.
Yeah, and I frankly came to the opposite conclusion, that even though it might be less effective than the full nasal thing, that to know if the child, before you sent him or her home, was positive or not was a good piece of information for a lot of players. And I couldn't follow the logic of why they elected not to do that. That was a week ago.
Right, that's the Binax Now. So the Binax Now is an antigen test, and the gold standard is a PCR test. Now the difference between them is the antigen test is not as sensitive, where if it came up negative, it's most likely a false negative. The positives were good, but the false negatives were still not. And either way, if you get that test and you come back positive or negative, you still have to go for a PCR test. So especially for some children, it's kind of like, you know, scary for them to get it done twice, even though it's just inside your nose and stuff. So why not get the other one first? And this is only in its trial phase. So this was them opting out of just the trial phase. There are some, I think I want to say Pittsfield, I'm not sure, but there are a few towns around that, not close to us, but that are participating in it. But this is its phase 1, and they're trying to get the kinks out, because the negatives is the issue. And again, whether you to get a positive or a negative, you still have to go for a PCR test, because that will pick up the proteins, and that is highly sensitive. So that's the whole thing behind that. Yeah, it would catch you immediately if you were positive, but if you're having symptoms, you know, just kind of assume you are. And because lately what I've been getting a lot of is people just saying, well, I thought it was my allergies. I had the window open, or I raked because it was a nice day, and they end up being positive, just allergy symptoms.
Thank you.
This
So
is,
Welcome, sir.
I have a question, Cheryl, and thank you for all you're doing. I find this distribution of the COVID within town, this information is very useful. A lot of the people that I talk to, they assume that if the number's higher, that this is all going on in the nursing home or the congregate living, and that if that, you know, it would be helpful, I don't know if it's possible, but it'd be helpful if the distribution list, to the extent that it can be shared, is done so every week or at least every month, so that the community recognizes, gee, this really is going on in the community. It's not just people who are confined.
Yeah, right now, like
So-
I said, there's one at the nursing home and one at or two at the nursing home, but one's in the hospital, and then one in congregate. And that's it for right now. I know they had a bad time at the beginning of COVID at
Right,
the
so I
nursing home,
think
but
that
right
has,
now it's mostly familial.
yeah, right, but I don't think that word has gotten out, is what I'm saying. A lot of people in the community still think that's where it resides, and that there are only a, you know, a few cases in the greater community, so they're not as inclined to be strict with themselves. Is there any
That's a
chance
very
of,
good idea.
yeah,
I will pass that on to Chief Dearborn, because he's going to be doing a robocall, and maybe he can announce that. That would be a choice beyond me, but I give them the information. So that's a very good idea, and I'll pass it on.
well, thank you. I would also like to see it show up in the newsletter once a month from the adult center. You know, just a listing like you did, just, you know, 5 in the schools, 2 at J&H, that kind of, you know, I understand there are privacy issues, but just a generic list like that could really help, I think, to educate the public.
Yeah, that's a good idea. I will pass that on, and when we to Chief and to Lynn and to Andy, and see how he wants to do that.
Thank you.
Thank you.
Please, Cheryl, I listened to the governor's report this morning, and he was complimenting, even though the cases are, you know, a huge problem right now, that the number of people in ICUs was more stable, and he credited to the fact that the hospitals have protocols that work these days. And you're a nurse, so I was wondering what, you know, do our hospitals, the Mercy and Baystate, et cetera, St. Francis, have the latest drugs, the Regeneron, the ones that Trump and Governor Christie got, they credit for saving their lives because they were older, and wondered if you call the local and get taken to Baystate, is Baystate up to speed with all that? That was approved for use a week ago by the CDC for emergency use. But is it made it to Springfield, Mass?
I think the remdesivir has. The other therapy it's still not FDA approved yet, but the remdesivir I think would be at the hospitals now. I can't tell you 100% sure because I'm not there, but what they also was talking about is he was crediting the fact that they know so much more so that they can take care of you better. And this whole thing has just been a learning event for the entire world. I mean, you know, every day it's something new, every day something changes, every day they discover, oh, this works, that doesn't work, oh, this type of whatever, you know, it's just a constant learning curve.
The results on the Regeneron cocktail are spectacular. You go in with a high viral load and they load you up, and before you get real severe, and it knocks it in the head. You know, even people with comorbidities are not getting put into ICUs.
That's fantastic.
Yeah.
Well, I just want to respect Cheryl's time. We are actually her 7th meeting of the day, and she has more to go. But Cheryl, with your permission, if anyone has comes up with a new question, you can email me, and I'll make sure it gets to Cheryl. And Cheryl, if you can let us know when that TV portion will be, and I can make sure our seniors know about it. That sounds really interesting.
Okay, yeah, Andy's in charge of that, so he and I will be doing it, but I don't know when it is. He just informed me yesterday.
Yeah,
Well,
that's great.
thank you very much. This was very useful.
It was
great.
very,
You're welcome.
very informative. Thank you
If
so
you
much.
go on the website, the town website, you can find my email there. It's covid19@longmeadow.org. It's pretty simple.
Okay, and
I am in that position till the 31st,
we'll
so.
keep our fingers crossed that you get the other position thereafter.
Yes.
Thanks a lot. I hope so.
All
Thank
right.
you very,
Thank
very
all for
much.
coming. Thank you for your
Thanks,
time.
Lindsay.
Thank you.
Thank you. Thank you so
Thank
much for
you.
inviting me.
You're welcome.
Bye-bye.
Bye.
Thank you. Bye.